structure at National 360 is that we have 4 clinical leads, so physio, OT, speech and behaviour support. And underneath each of those clinical areas, we have clinical practice advisors. So our clinical practice advisors are the experts in different fields of practice. So it might be assistive technology, mental health, paediatrics, home mods, and those staff work to make sure that we are up to date with evidence-based practice. They make sure that the quality of the work that we're putting out from National 360 is second to none. So they have all the checks in place, all of the clinical support. Any of our staff can access those people so that they know that when they're coming up with the intervention plan, the therapy plan, working through participant goals, client goals, that they are providing the best therapy to that client to give them the best shot at achieving their goals, because we've got the clinical support right behind them.
And then we have other senior therapists who don't necessarily want to manage others in a formal capacity, but they want to be amazing supervisors and provide the best supervision that they can. So they do the advanced part of the clinical leadership development program, or they may want to articulate into a specialisation. So they might want to pursue a career as a clinical practice advisor, and then the next step up from there is a national clinical lead.
A clinical lead takes overall accountability for the stream, coordinating and leading professional services, ensuring effective integration across all disciplines within the company. The role is also responsible for providing strategies to the leadership team on clinical matters that affect therapy, service planning decisions, policy and workforce management. A clinical practice advisor is a senior therapist who's experienced in a particular focus area, for example, paediatrics, housing, assistive technology, and they provide support to the other therapists for mentoring, supervision, clinical consultation.
The difference between a clinical lead and a clinical practice advisor is not only where they sit in the organisational hierarchy, but the type of work that they're doing as well. For each of our clinical disciplines that we have at National 360, which is speech pathology, occupational therapy, physiotherapy and positive behaviour support, we have a national clinical lead. And that person is responsible for the overarching processes and practices within that clinical discipline, and they work with other clinical leaders to make sure that there's a consistent approach towards our clinical practices at National 360. Our clinical practice advisors report into the clinical leads, and they're subject matter experts in really niche areas. So generally they're still maintaining their own independent clinical caseload, but they're doing things such as hosting regular education and training events, mentoring and clinical consultation to really make sure that all of our therapists at National 360 are supported for things that might be a little bit more complex than what they're used to.
We acknowledged a need to have a program where we could provide clinical advice and expertise to all our team members across the country, and this structure provides unparalleled clinical support through supervision, through mentoring and clinical consultation to all our team members.
The clinical leads and clinical practice advisors can ensure that clinical outcomes are the best for each participant using the frameworks that we have in place for quality assurance and for co-working files that are more complex to be able to have the best oversight of every client's report or assessment or ongoing therapy, no matter where they are in Australia, through that support network of clinical expertise.
It means that we have really easy access to be able to go and find these answers without spending a high amount of hours researching and going through journals. It means we can go straight to the source, and these therapists have that high level of evidence-based practice, and they're able to go and work with the therapist or just provide them the information to go out and provide that high level of service to the client.
I just think National 360 has so many layers and so many streams. There's something for everyone. It's an amazing place to come in when you're a new therapist and you want to learn something about the NDIS. When you're experienced and you may have something to teach, there's a role for you.